Have you ever wondered how the healthcare system worked in the United States of the Wild West movies? Come to think of it, it was not an easy task. During that time, the Western United States was as wild as you can imagine. Bandits, battles against the Indians, smugglers. Well, what can I tell you? I'm sure you've seen plenty of movies about it. Well, the point is that in the USA, at that time, infrastructure and services were quite limited. There was not even a single currency, because although today the dollar is the world's currency par excellence, 200 years ago, the dollar coexisted with other currencies in the land of Uncle Sam. It may surprise you, but each region had its own banks and their own very different banknotes. Be that as it may, the interesting thing is that the healthcare system was much the same. At that time, there was no large insurance network as there is today. There were no hospital chains, let alone public health plans to guarantee healthcare for everyone. And this brings us back to the question at the beginning of the video. If all that didn't exist, how on earth did American citizens in the Wild West manage healthcare? Well, the answer lies in health associations. You see, in small communities, such as in small villages, or in groups of factory workers, citizens organized health associations. In these associations, when a member fell ill or had an accident, the medical costs were covered by the dues of all the other members. It was like a kind of private insurance, but simpler and more self-managed. The point is that these kinds of associations existed for a long time in the USA, but not only that, they also existed in most countries around the world. Over time, they became more professional, until they became the well-known private insurance companies that we all know today. Even so, in this whole story, there was still one major drawback. That is, what happened to all those people who could not be part of any association and were left without coverage? What happened was, if they did not get money to pay for the doctor out of pocket, they could have a lot of problems or even die unattended. This is why, as early as the 19th century, several European countries promoted the first public health systems in history. We don't need to tell you, but by the end of the 20th century, public healthcare, or at least state-covered healthcare, had become the norm in many countries of the world. No sick person, no matter how poor, would need to be left unattended or suffer bankruptcy for not having health insurance. However, in all this, there was one big exception. Can you guess which one? Indeed, the USA. The United States has never been known for having an excessively broad public healthcare system, despite advances in most developed countries. In the USA in the 1960s, 1 in 3 Americans were still completely excluded from the healthcare system. That is, they had no insurance at all. It is true that as time went by, social coverage improved, and aid programs such as Medicare and Medicaid were approved, which did make the situation better, but the problem of health exclusion continued to exist. However, in 2010, something happened that changed everything. Can you guess what? Well, take a look.
Barack Obama's healthcare bill passed by Congress.
After congressional approval on the 23rd of March 2010, the President of the United States of America finally signed the Affordable Care Act into law. It was popularly known as Obamacare, as it was President Barack Obama's flagship political project. This law was an absolute game changer in Uncle Sam's healthcare system. It was a law that subsidized and even promised free healthcare access to all those who could not afford it. It was a law that promised to end many of the public health backlogs in this country. But above all, it was a law that was heavily criticized, and one with problems that were not apparent to the naked eye. So today on Visualeconomik, we will tell you exactly what Obamacare consisted of. We will tell you about its advantages, its problems, its results, and above all, we will deal with the most important issue of all. Was Obamacare a huge success or a huge failure? Today on Visualeconomik, we tell you all about it, so listen up. If we want to understand whether Obamacare was a success or a failure, the first thing to do is to know in detail what the objectives of this policy were. And the first of these, of course, was the most obvious. Obama's intention first and foremost with Obamacare was to guarantee, with subsidies if necessary, access to affordable health insurance for all US citizens, or even free of charge for those with the least resources. At the time this law was passed, between 10 and 15% of Americans were still uninsured, a figure equivalent to the population of entire countries such as Canada or Spain. But be careful, because there is one thing to keep in mind here. Even if a person does not have insurance, that does not mean that doctors will not treat him or her. or leave that person on the street. In the US, hospitals are required by law to treat patients with urgent cases, whether they have insurance or not. But if that is so, if you don't need insurance to go to the hospital, then what was the point of Obamacare? Well, let's see. On the one hand, even if the hospital treats everyone, the bills must be paid by the patients. And the problem is that many uninsured people, after going to the hospital, end up in debt for life. What's more, it is estimated that 62% of bankruptcy filings nationwide are the result of unpaid medical bills. But beyond that, the second problem with the lack of insurance is that many people with medical conditions or undiagnosed problems avoid going to the doctor so they don't have to pay the bills. Conclusion, uninsured people can have a 40% higher risk of dying prematurely than insured people. Not only that, but due to this situation, the United States is the industrialized country with the highest infant mortality rate, which is 50% higher than in other countries. This happens in part because many mothers with few resources avoid giving birth in the hospital to avoid the high fees. A real drama. Be that as it may, the goal of Obamacare went far beyond simply helping poor people get insured. Listen up. That's correct. The second goal of Obamacare was to fight discrimination. But no, we're not talking about discrimination in the woke sense of the word. We're talking about discrimination by insurers. You see, typically, insurers in the US price the chronically ill and the elderly at skyrocketing rates, which, of course, meant higher costs for healthcare services. In fact, in extreme cases, insurers did not even offer insurance to very sick people. As you can imagine, this was especially worrisome, considering that nearly 70% of deaths in the country were due to chronic disease. Be that as it may, there was still a third problem that Obamacare was intended to solve. Remember how we told you that in the USA, hospitals were obliged to treat people without health insurance, no matter how much they could not pay? Well, this obligation stems from a law dating back to the 1980s, which applies exclusively to emergency rooms. That is, if an uninsured person wants to be treated, he or she must go to the emergency room. So what's the problem? The problem is twofold. On the one hand, if there are many uninsured people, emergency rooms become overcrowded, causing an even greater health problem. But on the other hand, the hospitals, which are very smart, began to reduce emergency rooms so as not to lose money attending to people without resources who could not pay. In fact, since the 1980s, the number of emergency rooms has been declining across the country. So, in short, until Obamacare, many people lacked insurance because they could not afford it. Others were uninsurable because they were too old or had chronic illnesses. And on top of that, emergency rooms tended to be overcrowded or insufficient. The question is, what did Obamacare propose to fix all this? Well, let's take a look at that now.
Obama's solutions.
The first problem that Obamacare attacked was precisely that of guaranteeing public insurance to the poorest. To this end, it expanded Medicaid to provide free public insurance to all people earning less than 133% of the federal poverty line. And how much is that? To give you an idea, it is equivalent to about $33,000 per year for a family of 4. Now, that wasn't all. For people with higher incomes up to about $100,000 per year, Obamacare also subsidized insurance prices. For example, a family with an income of $50,000 per year has to pay only $266 per month for health insurance. Not bad, considering that the average subsidized cost was over $1,100. In any case, Obama went much further. Obamacare regulated insurance into different categories based on the percentage of coverage, made all insurance cover the essential treatments and services you see on the screen, and guaranteed by law a maximum out-of-pocket payment amount for each patient. And what is this out-of-pocket amount? Basically, it refers to the fact that not all insurance companies cover 100% of the cost of treatments. Normally, they include a percentage of between 10 and 40% of the cost that each patient must pay themselves. Well, although patients must pay out of pocket, since Obamacare, the total amount can never exceed a maximum of $8,550 per individual per year. And that figure decreases the poorer a citizen is, reaching zero if the minimum threshold of 133% of the poverty limit is not reached. Beyond help for the poor, Obamacare solved insurance discrimination in one fell swoop. This law prohibited insurance providers from discriminating against policyholders because of pre-existing medical conditions and forced them to offer the same rates regardless of their health status. What's more, for seniors, Obamacare restricted the premium discrimination by insurers, making seniors pay, at most, 3 times as much as younger people. Yes, it's still a significant difference, but considering the costs and that Obamacare already guarantees insurance to people without resources, it's not bad either. And as if all this were not enough, to keep insurers from going overboard, Obamacare also imposed a cap on insurers' profits, forcing them to spend at least 80% of their premium incomes on actual healthcare spending for patients. In other words, it forced them to keep only a maximum of 20% of revenues, thus limiting their profits. These were the main changes introduced by this huge legal reform. So now, logically, the question is, did all these measures work and solve the problems of the US healthcare system? Was Obamacare a marvel of a law, or did it have major problems behind it? Well, let's take a look.
A law for better?
As we've said, the main objective of Obamacare was to increase the number of insured people in the US. Well, as you can see in the graph, this goal is met in a big way. The population without health coverage dropped rapidly from 15% in 2010 to 9% in 2015. This in itself could already be considered a success. However, there are 2 factors to take into account. The first is that Obamacare only affected people with legal residency in the country, and undocumented immigrants remain unprotected. And the second is that after a series of legal battles, some states in the country, such as Texas, did not implement the Obamacare expansion. In other words, Obamacare was only implemented in certain states, which are the majority, but the point is that it could have gone much further. Even so, the problem had some advantages, at least in statistical terms. Because Obamacare does not apply nationwide, researchers at American universities such as the University of Michigan have been able to compare mortality rates in populations aged 55 to 64 in states where Obamacare was expanded and states where it was not. And what was the conclusion? The conclusion is that with Obamacare, thanks to the higher insurance ratio achieved, mortality among adults was reduced by more than half in the states where the law was implemented. Between 2014 and 2017, Obamacare saved 19,200 lives where it was implemented, and sadly, an estimated 15,600 lives were lost in the states where it was not. On the other hand, and mortality issues aside, another big problem prior to Obamacare was the huge bills paid by many uninsured or underinsured citizens. In this regard, Obamacare succeeded in slightly reducing the out-of-pocket costs faced by many patients. In any case, Visualeconomik viewers, if Obamacare had so many positive results, why has it been such a controversial law in the United States? Why do many think it was not a great idea? Well, listen up.
Or a law for worse?
As the saying goes, all that glitters is not gold in Obamacare or anywhere else. Although President Obama's law succeeded in placating several deficiencies in the healthcare system, it also generated major problems. For example, the Heritage Foundation estimated that after Obamacare, insurance premiums skyrocketed astronomically. In 2013, the average monthly insurance premium was $224, but this more than doubled in just 6 years to $558. The question is, why did Obamacare drive up the price of insurance so much? Well, for several reasons, but the main one is that by having to insure everyone regardless of their health, or to do so at a lower price regardless of their age, insurance companies compensated for this loss by raising prices for the rest of the population. Another possible explanation is that Obamacare and the introduction of its regulations greatly increased the administrative costs of the healthcare system. To give you an idea, administrative spending in the United States accounts for 8.3% of all healthcare spending, while in European countries such as Germany, it is barely 4.8%. But this is not the end of the story. Since the implementation of Obamacare, healthcare-related companies have outperformed the major stock market indexes. Apparently, Obamacare has benefited them. It has made them more money. And you may ask, but why have healthcare companies benefited since Obamacare? If, in theory, we have said that their profits were capped. Well, let's see. The limit on their profits was that they had to spend a minimum of 80% of their premium income on actual healthcare costs. The insurers could only keep 20%. But following this ruling, the companies came up with a loophole. They started buying up pharmacies, hospitals, and clinics, and started spending that compulsory money on themselves, naturally by increasing service prices, and therefore revenues. You know, as soon as the law is made, so is the loophole. As you can imagine, all this not only meant a simple increase in prices, but also a large additional expense for the public treasury, which, on top of the widespread deployment of subsidies, ended up increasing the total expenditure of the country's public healthcare system, reaching a quarter of the country's entire public budget. Something that, not surprisingly, Republicans have harshly criticized for increasing the national debt. In any case, and at this point, it is now time to hear from all of you. Do you think that Obamacare managed to solve the problems of the US healthcare system? What would you do to avoid the price issues? Do you think the US should make another healthcare reform or abolish Obamacare? You can leave me your answers in the comments. And as always, don't forget that here on Visualeconomik, we release new videos every single week. So subscribe to this channel, hit the little bell so you don't miss any of our updates. And if you like the video, like it, and I will see you in the next one. All the best. See you next time.